My name is Tim Harris. I work as Professor of Emergency Medicine in the Royal London Hospital. That's part of Barts Health, which is a mixture of 5 hospitals in East London. It includes Barts and Bartholomew's, the world's oldest hospital and oldest medical school and Europe's biggest heart attack centre. We're also home to London Hems, which is Europe's busiest trauma air ambulance. We send a doctor and a paramedic out to any trauma in London, and we can get to any trauma within a mean flight time of 6 or 7 minutes. We're also the busiest stroke team in London, and we've got a thrombolysis rate of somewhere between 15 and 17% at the moment. The UK and perhaps Europe's busiest trauma centre, we have somewhere between 2 and 5 trauma calls per day. So each year we see somewhere between 800 and 1,000 patients with an ISS of 15 or greater. So with all those sick people around, not surprising that my interest is resuscitation. And that's diagnosis, for which of course ultrasound is probably the single most important factor, and resuscitation, that's giving the right volume of fluid to return my patient's oxygen delivery to normal. And again, key for me in that is ultrasound. So at the moment I use a mixture of IVC and LVOT VTI to guide volumes in resuscitation. The problem is, IVC doesn't really tell me much about patients' changes in cardiac output and stroke volume. So that's taken me to develop an interest in the LVOT and look at how the volume of blood or the mass of blood ejected through the aortic valve changes in response to a bolus of fluid. The problem is I can't get all my nurses and doctors to do that. It's a bit fiddly. I do an echo list as an observer for an afternoon each week, and I've been doing that for the last 3 years. I can't send all my docs up there to get that experience. It's just not realistic. So at the moment we're looking at other ways of measuring cardiac output, and I'm sure many of you are aware of suprasternal Doppler devices, bioimpedance devices and plethysmography devices. And we're comparing how those perform against the VTI, and we're using the 3300 as our gold standard for that.